and kick us off. Hi everyone, good afternoon. Hope you're doing well. Welcome to our September monthly session for our San Joaquin Stanislaus Collaborative. Thank you all for joining us today. Just a few reminders for folks. We are recording the session today, so it will be available for you to watch or share on YouTube. If you haven't already, it's always really helpful if folks can just update their Zoom name just to include their name and their organization, especially for folks that are joining for the first time. I think it's just helpful to see who's in the room. For our icebreaker question today, since I know I'm personally getting into the fall mood, just curious if folks had any recommendations or what their favorite fall movie or maybe TV show, or doesn't even have to be fall related. Maybe it's something you like to watch around this time of year. Feel free to put that in the chat. I'm sure we would love recommendations. And then as always, hope to make this an engaging and collaborative session. So we'll ask folks to engage and, use the chat or unmute as you have questions or thoughts. And I will just see if folks are putting things in the chat. Start of Harry Potter season. Awesome. Thanks, Crystal. Yes, feel free to put those in the chat. Okay, so and then moving on, so do want to give a welcome to any folks that are joining us for the first time. Our collaborative meetings are a space for regional CalAIM stakeholders to come together to collaborate, identify challenges, and problem solve with the goal of improving CalAIM implementation and driving utilization. I know during our in-person session, we had lots of folks that mentioned that they were joining for the first time, so hopefully some of them are on the call with us today. So encourage you all to ask questions as things come up and connect with one another. We do also like to hold space if someone is joining for the first time and they want to share a brief intro and just the organization that they work for. If anyone would like to do that, I will pause, but no pressure. But we'd love to meet new folks, so we'll hold space if anyone wants to unmute.
So this is my first time on the call. It's Keith Amador. I'm calling from Stockton, California. I'm actually program manager for San Joaquin County Behavioral Health Services AB 109 program. So we basically have a reentry program and a pretrial program here. And I was fortunate to be at the last in-person meeting. Guess it's been a couple of weeks ago. Was able to be on the panel discussion there. And so it's great to join here and to meet all of you, and looking forward to hearing more information today.
Awesome, thank you, Keith.
You bet.
Was there anyone else that wanted to do an intro?
Yeah, I'm Lamar Smith, and this my wife, Shay. We out of Stockton too. We own sober living homes, and we're just trying to get more involved with get to know the community and everything, and all the resources that's out there.
Awesome, thank you. I know we've been communicating via email, so great to see y'all join us. Awesome. I don't think I see anyone else that unmuted, so we'll continue, but feel free to put stuff in the chat. I know we've been getting a lot of suggestions for movies and things in the chat, so awesome. Okay, so here is today's agenda. You'll notice it looks a little bit different than kind of how we typically do things. Thought it would be fun to maybe switch things up. So after kind of our welcome and level setting, we will be doing a discussion on sustainability. So for folks that were able to join us in the in-person, we had done a workshop around sustainability. So per your request, we do want to spend a little bit more time kind of talking through the Health Equity Policy Hub and Mobilization Network. I know we have Sadhna from our team who's joined us as well today. So we'll move into that. And then we'll do some information sharing. So we have our MCP updates. We'll hold space for regional spotlights, so for folks to share any announcements with each other. And then we're also gonna do a presentation on PAVE to provide an overview and kind of the enrollment process and some resources. And then in our next steps and closing, we'll share a little bit more information on like updates and resources, which we kind of do at the top of the meeting. And then we'll close out with just information on office hours and one-on-ones. So here are the session objectives. So kind of how we were talking about with the agenda, we'll provide an overview of the Health Equity Policy Hub and mobilization networks, talk about how it can support sustainability efforts. We'll receive MCP updates and resources, as well as share regional highlights and announcements. And then we'll share more information on PAVE, the Provider Application and Validation for Enrollment portal, walking through the enrollment process, common denial reasons, as well as share resources. And then also wanted to take a moment to just share a big thank you to everyone that was able to attend our in-person session last month. We had really great engagement and a lot of folks that came out, including a lot of folks that joined for the first time. Our Justice Involved panel was definitely a success, and we had around 85 individuals attend from 38 unique organizations, which was really cool to see. In our survey, just wanted to reflect back on some of the learning slash reflections from our attendees on what was most valuable from the session. So just wanted to highlight again that folks really enjoyed the opportunity to network and connect with one another, getting to learn about the JI Reentry Initiative, as well as just sharing updates and resources. So thank you all again for that session, and a big thank you to Stanislaus County for giving us the space to hold this session and being very responsive to any questions or requests that we had. And then with that, we can move on to the next section, and I believe at this point I will pass it to Sadhna.
Thanks, Navneet. And I'm really excited to see everybody in the room today. I wish I could have been in that in-person session. It sounds like it was a really lovely one from what we heard here today from the folks who unmuted, as well as from my team. So I'm glad that we're coming off the heels of that. My name is Sadhana Devaraja. I'm managing director and a partner at Health Begins. And I was asked to come and talk a little bit about sustainability. And kind of before I do that, I do want to kind of just recognize that in this moment, a lot of folks may be feeling a lot of different things, both related to kind of Medi-Cal transformation, related to changes that have been happening at the state, changes that have been happening nationally, and have generally kind of heard some uncertainty in the air. So if we go to the next slide, I wonder if folks can just share with me, and it's a blank slide on purpose, in the chat, just one word to kind of describe how you're thinking about, or a word that describes what you're feeling about your work over the next year in the Medi-Cal space. I know it's kind of hard to distill it to one word, but I'll pause for a second. Excited, uncertain, promising, uncertain, unpredictable, excited, shaky, optimistic. I love this. Thank you so much for kind of that mix of words. And I'm really heartened, and please keep them coming. I kind of love seeing this waterfall of what folks are experiencing in this moment as they're thinking about the year ahead, and when they're planning for it, and what opportunities lie ahead. If you click through quickly, I will say in a lot of spaces nationally that we're in, we're hearing a lot of kind of these terms around uncertainty and overwhelm and kind of new terrain. So if you click through just to the end, what we're focusing on at Health Begins is to figure out how to take some of these opportunities, as well as the optimism, as well as the kind of challenges ahead, as well as the excitement, and convert it into agency. And that's been a lot of like our sustainability focus. So if you go to the next slide, this may be a framework that some of you have been exposed to. I think especially if you were in the sustainability work group, you may have seen this previously. For other folks, this may be new, but this is how the facilitators across the state have been thinking about sustainability and how are we going to support sustainability of all of the great work that you all have been doing over these last few years and make sure that it endures for the years ahead. And so I'm not going to go through this slide in detail other than, just to call out that there are these 4 domains of resource, environment, people, and change that we're thinking about as we think about sustainability. And for my 10 minutes here, 15 minutes here, I'm really going to focus on kind of 2 mini aspects of this. So if you click through, you'll see one is on this political kind of component within the environment, as well as intrinsic resources. So what I just shared about converting some of the uncertainty into agency, as well as ways of taking what's happening in our political and environmental context and being able to convert that into agency. So specifically, the way that we're doing this, if you go to the next slide, is through something that we call the Health Equity Policy Hub. If you click through, you'll see that there's 2 components to this. And if someone on our team can just drop in the link to the hub, that'll be great so that folks can click through it and see what it is while I voice this over, which is we have a health equity policy tracker, which tracks the policies that are impacting health equity. And not only is it tracking it to make it easy to read and for people to understand, we know that all of the providers and the payers, the folks that are actually active doing this work, can't also be tracking against every kind of opportunity as it comes through. So the tracker helps do some sense making and helps people have some language around what this federal executive policy is, as well as do some early kind of analysis on what the impact to health equity would be. But really importantly, it also helps you think of some institutional actions for it. And I'll go into that a little bit on the next slide. And the mobilization network is a place where individuals and groups can come together and use a platform to be able to convene and to be able to kind of think through actions that they may want to take on locally together. So I'm going to go deeper into both of these with the next couple of slides. If you go to the next slide, you'll see the policy tracker. So if thanks, Melissa, for putting this in the chat. If you click on the link in the chat, you'll see these cards as well. And what they do is really, and if you click on the cards themselves, you'll see, a little bit of background on each policy. It'll give you just a little bit of background on what the health equity impact is. It'll share some kind of legal updates with you, but then there's also a section on institutional actions. So helping you think through what is it that we can do about this policy? If this policy is threatening our organization, or if it's threatening the people we serve, are there actions that we could take to be protective or to be responsive so that it's not only happening to us? I don't want to be Pollyannish about this. I know that a lot of the funding threats that came from the federal level and now also from the state level are real. We know that a lot of the other types of threats that are being made are very real. But this does give us a foothold for some action. The one that I love talking about is the immigration-related cards, where we are able to offer ways for organizations to really think through what policy changes they can make to be supportive of their communities. And I'll describe that in detail in a couple slides down. If you go to the next slide, it'll just kind of capture what the policy tracker does. It helps you quickly understand the federal executive policies, how they impact health equity in your work. They help you learn some ideas for institutional actions that you can advocate for at your institution or for a partner to take. And we've been hearing from a number of users that they also use the resources in the tracker as background for their grant applications or when they're doing educational offerings in their communities. So that's some of the ways that people have been using it. And the reason that ties into sustainability is to sustain their programs and also to share kind of the impacts of the harms that are happening now, to be able to either approach more funding or to build like a more comprehensive case for like the harm that's happening right now. If you go to the next slide, the mobilization network is that second part of the Health Equity Policy Hub that I mentioned. And if you go to the excuse me, next slide, the mobilization network, what that does is that it really sets up a community of like-minded health professionals across the country to be able to share resources and ideas. You'll see here we have monthly meetings of these individuals. They are all across the country. They are in Eastern Washington, in California, Cincinnati, St. Louis, Virginia. So it's just a broad base of individuals who are addressing similar things, and also some things that are unique to them, but can use other kind of vantage points to help them think through what strategies they should be using, what kind of coalitions they need to be building, that sort of thing. We've also offered trainings and workshops. So our first training was in partnership with People Power Health on how to organize and advocate for policies that are protective of the communities we care about. And then we have been putting together kind of an informal organizer toolkit based on our partners' materials, as well as materials that our network has been building for their strategies and for their kind of actions themselves. And so if you go to the next slide, this is kind of just the summary of it. You know, the Health Equity Policy Tracker helps you understand the policy, how your institution can respond. And the mobilization network then converts that concern into action, allows you places to search for actions, to join a group, to start a local group. You know, when we're thinking about the collaborative transitioning, there may be opportunities within this region for there to be a group that starts that has this kind of advocacy bent. So I'll just kind of see that idea here. And then if you go to the next slide, you can see kind of how it works together. And that immigration context that I shared with you. So on the tracker, if you're concerned about policies affecting immigrant communities, you can search by those terms, or you can filter by terms similarly. And this enforcement action in or near protected areas, which came out on January 20th, might be one of the ones that pop up, or will be one of the early ones that pop up. And so in addition to describing what that is, there are resources. I don't know if this resource made it onto the card yet, but there are resources like this Healthy Harbors for All Californians that the Family Docs put out that is really super helpful. I recommend everyone take a look at it. It's in depth. It really shares how institutions can set up private public waiting areas, how they can set up an individual who's in charge of making sure that they're the only ones looking at legal documents, and so that any sort of inappropriate kind of readings of legal documents aren't happening, to be able to protect the patients that you're serving. I believe there's components about how you could be supportive of families that don't feel safe leaving their homes right now. So just things like that are policies that we can enact to help shore up the sustainability of the care that we're providing. And then another example is the next slide. In this other example, it was about preserving and protecting the integrity of American elections. And similarly, you know, there are resources about how to support voter registration. So there's actions that your institutions can take to be able to not just allow these executive orders, which have, you know, really terrible sounding names at times, and actually have a meaning that contravenes their title, and do something at your institution to support the sustainability of the work that you do and what matters to you. So I believe that's my last slide. That was my overview on the Health Equity Policy Hub as a vehicle to support sustainability of your efforts and to support the sustainability of the partnerships that you've built and the relationships that you've built, and really use it as a vehicle to be able to continue to take action that is supportive of the policies that you want for your communities. And I'm open to taking any questions that you may have about the hub, the tracker, or the mobilization network.
Sadna, I just want to say thank you so much for this information. I never knew about this, and so this is great. I always want to be informed of any new policies that are coming up. I'm just saddened that this is not available to the masses and not provided this information to our, constituents in all of our counties to be able to fully understand what new policies may very well affect their trajectory in life. So I'm going to be doing my part in getting this information out there. So thank you so much for giving this information to the meeting. Thank you, Sadna.
Thanks, John. I appreciate that feedback, and something that we've been thinking about and trying to figure out, and maybe even with some of the mobilization network organizers, is that the policy hub is really focused on federal executive policies, which are certainly impacting our work right now. And there's also state policies that are impacting our work right now. And so thinking through in a number of states, what does that look like to be able to share back those same kind of policy learnings, and similarly think through collective action related to those policies on the state level, especially as we go forward. So what you said about kind of sharing it with broader communities, and especially in California, resonated with me, and thinking through how we can help bring that like collective power to the work is something we're thinking about. I don't know if there's like, if folks, especially folks that were like participating in the sustainability conversations to date, if there were any kind of sustainable like questions about sustainability that were coming up for you specifically that you think may be implicated by some of the policies that we've been talking about, or kind of maybe just a little bit more color on the sustainability conversations, so that I can help make some tie-ins if needed. And I may ask the Health Begins team to like help. But I don't know who was in the sustainability conversations to date.
No, Melissa was leading that, but I'm not sure if she's,
Yeah, I think some people might not be here.
Oh, okay.
I know we had a couple people who really just wanted to see how to operationalize using the mobilization network, and I think starting to introduce it a little bit is generally helpful. But I'm curious, Sadhana, if you've seen any kind of lessons learned from those who have started their own small networks in regions, and how that's going, if you can talk about that.
Yeah, I think that's great. Thanks, Melissa. I think the mobilization network can be especially helpful for this community as we think about like what future state of collaboratives look like, right? Like this collaborative won't be here forever. And so what does like the next iteration look like? What we have seen in other California communities is some of the kind of lead collaborative members set up a mobilization network organizing kind of group. So they signed up for the mobilization network, and they've been coming along to our monthly meetings, and they have been kind of considering when the transition point comes, will it be possible to transition like collaborative over to this other infrastructure and still have a support of a monthly meeting that would be nationwide, not necessarily California specific or regional specific, but still encourages that like that thought partnership for a lead facilitator. So I think that's one kind of, I don't know if it's a best practice, but that's something that has been intriguing and exciting for me, is seeing participants from other collaboratives through CPIs join the mobilization network to think about, how am I going to keep up this energy around Medi-Cal transformation for my community moving forward? And I think another way, and it's kind of similar, another way that people have been engaging is that they have their own networks. Like, right, we're not trying to create coalitions where coalitions exist. And so Utah, we see this where they have a really vibrant Protect Medicaid Utah organization, and they send a representative to our mobilization network meetings so that they can thought partner with us, and then they take it back to Protect Medicaid Utah, and they move forward on their actions, but with that additional kind of thought partnership and support from our more mobilization network across the country. And so that I think that's another best practice to consider. If folks are part of existing organizations, you don't need to create a new one, but if you think you might benefit from being in a space with others to share best practices and think about how to strengthen your collective efforts or to hone your strategy, that might be an entry point for you. I think I'm at my time, so I'm going to turn it back over to Navneet. But if folks have any questions, here or later on, please reach out to the Health Begins team, and we're happy to, talk to you further about this.
Awesome. Thank you so much, Sadhna. And then I will move us to the next section. So now we're going to move on to some MCP updates. So I wanted to pass it to Nancy from Health Plan of San Joaquin for any updates.
Good afternoon, everybody. Good to see everyone and happy Monday. Hope everyone had a restful weekend. I can't believe we're already mid-September. Just in terms of MCP updates, the Health Plan of San Joaquin and Mountain Valley Health Plan, as you know, we are in the midst of getting prepared for transitional rent go live for the behavioral health population of focus. That's going to be going live 1/1/26. So we're working very closely with our implementation team and our counties, specifically in San Joaquin County. We're working very closely with the county behavioral health in terms of becoming a TR provider and then using CVLIC as the flex pool operator. In Stanislaus County, we are looking to implement with a few providers. We want to keep the network small and working very closely with Turning Point and Tracy Community Connections for a transitional rent contract for Stanislaus County. Closed loop referral, we're going to be bringing more material, more information very soon. The system is going to be going live later in Q4, but we're going to be sharing some provider alerts and some upcoming information in terms of how we're going to get providers such as you prepared for the closed loop referral process. It's going to be very, very important. It's going to be a new system, and I think it'll be very useful in terms of referral management. So I think all in all, it's going to be a really positive implementation. So more to come on that. We'll probably from an ECM community support closed loop referral, we're aiming closer to the new year, even possibly in March. So more information on timelines will be shared. Again, if you have any questions, everything is on our CalAIM website, and I'll drop it in momentarily. I can't multitask right now, but feel free to look at our CalAIM website. We have our updated provider network. As you know, there is now a community support volume 1 and volume 2. So make sure you have access to the DHCS website and all of the policy guidelines. A lot of changes or changes for housing deposits. So I really want folks that are implementing housing deposits to kind of take another look and review into that specific guidance, just to kind of double check all of the changes. And I'm open to questions, but I want to give folks, my other MCP colleagues, time to provide their updates as well. Casey, great question. We are still waiting, as you know, for the rates, transitional rent rates. I heard fall, I heard within the next few weeks. I'm crossing my fingers by the end of September, but right now, according to DHCS, they're stating fall. I know we're in fall, so hopefully we'll get those rates momentarily. You're so welcome. And again, you know how to contact me. Navneet has a slide up here with my email address, so I do have to drop, but feel free to email me if you have any questions. And thank you again for such a wonderful collaborative and supporting our members. Thank you.
And thank you so much. Now I'll pass it to Ileana from HealthNet.
Thank you.
Oh, awesome.
Hi, thank you. Good afternoon, everyone. This is Eliana. Thank you again for the opportunity and the space to provide updates. No major updates. I think, Nayeli did a great job in covering some of the MCP and general sort of updates. A lot of work with transitional rent. Again, as she mentioned, identifying those potential providers who are going to be able to serve our members going live on 1/1/2026. So we're continuing to kind of continue those conversations with some of the selected providers that have been identified and looking forward to reviewing their applications and determining readiness. In San Joaquin County, as it was mentioned, Behavioral Health Department will take the lead as a TR provider by subcontracting some of the work with a local organization, as well as being the flex pool provider. And that's a big undertaking. So there's going to be some work that the MCPs will be doing in collaboration with the behavioral health departments along establishing the flex pool in that particular county. Just as involved, another update that we always like to share is we're continuing to work with the correctional facilities on their readiness assessment. We actually have a meeting coming up sometime this week to continue those conversations. Again, another big lift as we continue to talk about CalAIM and exploring opportunities to serve our members. I think Nayeli did a great call out around the 2 volumes of the community support policy guides and those very crucial updates. I'm in the chat. I'm going to drop, as usual, our CalAIM resource for page providers, which includes all of our authorizations, our referral forms, and we have indicated which authorization guides have been updated based on the new guidance. That includes housing deposits. And so please take a look at that. Feel free to reach out to myself or your primary point of contact here at HealthNet. Happy to schedule a call and continuing to review some of these updates. In regards to closed loop referrals, no major updates, but I do want to share that within the CalAIM resource page for providers, we do have under trainings opportunities for office hours, and that is all things data sharing related with our ECM and CS providers. So at any time that you have any questions, feel free to reach out to me or your point of contact and also attend any of those office hours that are available for this team. I think outside of that, I think those are some really high level updates around some of the work that we're doing here at HealthNet, but happy to take any questions or share any additional resources. All right, well, thank you all. And
Ileana,
just as go ahead.
Can you help connect the providers that might want to be interested in subcontracting with San Joaquin BHRS together?
I think that's going to take a further conversation, Casey. Great question, but let's take it offline just because we're working closely with Behavioral Health Department, and so we have to make sure that we're aligning with who they've also identified. So that's not a no, but it's definitely let's continue that conversation.
Fully understand. Thank you.
Thank you. And I got your application today. Thank you, Casey.
Thank you.
All right. Well, thank you so much. And as a reminder, I'm going to drop in my my email address in the chat in case you have any questions after the call. Thank you so much.
Thank you, Ileana. Now I will pass it to Kat from Kaiser Permanente.
Good afternoon. I have a few updates, and I'm going to start with the survey slide, please. Kaiser actually partnered with nonprofit organization, Finance Fund, on this survey. This is actually to help, to understand the financial status of the CBOs and who are delivering housing-related community support under CalAIM, and especially the challenges around cash flow, reimbursement delays, and service expansion. This survey finding will inform institutional partners about current CBO financing need and the type of capital that could address them. We are actually asking this survey to be completed not only with contracted providers for Kaiser, but any provider that do provide these community services. The responses will be aggregated to protect organization confidentiality. If you have any questions, please let me know after the meeting. Next slide, please. Actually, we're gonna go over our CalAIM updates. This is actually for Q2. And this is for San Joaquin. We are looking at the numbers of adults who enroll in the ECM program. On your far left, you can see that the experiencing homelessness is 29. I'm not going to read all of them. And then also bed equity actually increased to 20. If you see look on the far left, you see the less than 10. If we are not reporting that information because we didn't have enrollment that were 10 and upwards. So the numbers are suppressed, but you can also find information on this on the DHCS side. Next slide, please. For San Joaquin itself, we are looking at the Q2 numbers for community support enrollment. We are looking at the housing security. So anything that has to do with housing, we had 79 that were enrolled in the program. And then keeping people at home, meaning services that will actually allow seniors to be at home, or people experiencing homelessness or at high risk. Keeping them at home, you had about 39 of them that enrolled in this program. And then improving those with chronic conditions, we had about 115 enrolled in the program. This is for San Joaquin. So the next slide is, I believe, is Stanislaus. Same thing, the numbers that we have here reflects the number for the members that enrolled in the ECM program. You are looking at the SMI or the SUD needs. You had 15 that enrolled. And on the children and youth column, we are still below the threshold, so that those numbers were not reported. And Casey, I see your hand.
Yeah, Kat, I was wondering, when it comes to the CS services, I wasn't able to see which category or which CS service the individuals were actually getting, whether it was, navigation, medically tailored meals, asthma remediation. It looked like it just broke it down into 4 different categories, and maybe I was misunderstanding how the slide was set up.
Yes, we actually made that for simplicity. Because we group them in different buckets. Like, for instance, the housing trio, you see it goes under housing insecurity. And then keeping people at home, it actually falls under the bucket that you're talking about. And then improving people with chronic condition, then it talks about like people with diabetes, complex care management, all of this, it falls under this one bucket. But we can talk offline if you need more breakdown for these numbers.
Okay, thank you.
No worries. Thank you so much for that question. And I believe slide 8 should be the next slide. We are looking at Stanislaus housing insecurity. We have 26 members that were enrolled in the program, as well as keeping people at home. You had 17 that enrolled in that program. Improving chronic condition, we have 67. And recovering from acute intoxication, we had less than 10. So that number was suppressed and it wasn't reported. Next slide, please. On this slide, actually, Kaiser Permanente makes it easy for members to actually manage their healthcare online. So we are encouraging all the Kaiser members to actually sign up onto kp.org, so you can actually manage your healthcare, look at your lab results, refill your prescriptions, and actually contact your doctor. Next slide, please. We do understand that kids age 13 to 17, they are actually transitioned from their parents' account, it's very important that they sign up and actually set up the account for themselves so that they can manage their healthcare. But it doesn't mean that the parents cannot also assist them. The parents can actually help or ask the teen to add them as action for family, that the tab will actually allow the parent to sign on to that account. So this is for privacy reason that the teenage kids are actually assigned a separate account from their parents' account. But again, it doesn't limit the fact that the parents can actually have access to that account. I believe that comes to the end of my slides. Are there any questions?
I follow what the last question was. I would love to see they break up the community support services. How many cases we're seeing for meals, how many cases we're seeing for asthma remediation. We have a very low referral caseload, and we're trying to figure out where is it that we can improve that. And I think seeing those numbers will be helpful.
Absolutely. I am going to put my contact information online, and please, if you can just send me an email for me to send you that information, I'll be more than happy to do that.
Thank you.
I have a question. Oh,
yes.
Excuse me. I have a question. Will Kaiser be working with Medi-Cal clients that are being funded for housing through Medi-Cal? Because they coming into an issue where they need, Medi-Cal needs to have outpatient showing that they were seen at the hospital and that they were discharged, or whatever the issue was that they were having, so that they can have housing.
Actually, if you're a Kaiser member, they are care leads that could actually help you with that question. I do have my information on the chat. Please,
Okay.
if you send me an email for me to triage your question to the right folks that could actually help you with that. If that's
Okay. Okay, that sounds good. Thank you.
Thank you all so much.
Sorry, didn't mean to stop the share. Okay, so thank you, Kat. Now I'll pass it to John to do regional spotlights.
All right, so good afternoon, everybody. We are doing regional spotlights, so looking for local updates from our CPI stakeholders. So please share if you have anything new or anything regarding your organization with ECM and CS. Inform us if there's any upcoming events or meetings that you would like for the group to know, whether it be in San Joaquin or Stanislaus County. And any recent successes that peers would benefit from knowing. Any tricks of the trade is always fun to know on how to scale up your services and build your capacity. So does anybody have any information out there on this call that they would like to share? We get a lot of people wanting to be involved during the in-person. I don't think there's any difference between the in-person and the call. No, but no, you guys.
I can share something, John.
Hey, Jory, how are you?
Hey everyone, Jory, Family Promise San Joaquin County. It's not actually an update for us, but just an event that you guys should know about. This upcoming Saturday is a big event over in downtown Stockton at Weber Point Park. It's called Family Day at the Park, and we are going to be tabling at it as well as like a lot of others. Health Plan of San Joaquin has their own area, and we're part of that area. But if you guys have interest in learning about other things in the community, there's going to be a ton of community resources that will be at this event, and it's a free event. So just throwing it out there as PSA.
Hey, Jory, when is your gala happening? And could you tell us a little bit about your gala?
I can do that as well. We are doing our first ever gala on October 18th. It is an exciting one. It's at a very special location, the Cordopassy Family Foundation. It's at their private estate, which my wife likes to say it feels like it's walking through Tuscany. Very beautiful. And it's going to be raising funds for our shelter program. I can put information about our gala in the chat. However, we are getting close to capacity of how many more people we can admit to it. So if you are interested in going to the gala, you should apply. You should register for it soon. But thanks for asking, John.
Oh, wow, that's amazing to hear that you guys are getting pretty close to capacity.
It has been a lot of good response. We're really excited.
Good. Thanks, Jory. Appreciate that.
John, I actually do have something. I'm putting this in the chat, but we have another project through Health Begins that is in partnership with Health Plan of San Joaquin, not related to CalAIM, ECM, or CS. But we are doing a couple of one-on-one interviews with Latina women between the ages of 45 and 64 living in Stockton, who have not seen a primary care provider and are Medi-Cal beneficiaries over the last 12 months. And so if you guys do have anyone that you know may be eligible or interested to participate in the interviews, we are compensating them up to $100 to participate in the interview. And really just trying to identify, you know, what is the barrier for them accessing primary care, and actually following through with their appointments and things like that. So I did drop the flyer in the chat if you guys are interested in sharing that with anyone. Eliana, I see your hand up.
No, I didn't mean to cut you off, Melissa. I just wanted to share an update as well.
Okay. Yeah, so if you can't see it, I will make sure that this is sent out in our communications after this so you guys have access to it. But other than that, that's what I wanted to share. Let me try and share it again just in case any of you know anyone that might be eligible or interested. Yes, I'm gonna put that in right now. Let me know if this one works. And happy to field any questions. So this is not related to the collaborative. So if you do want to get any questions answered, please contact me and I'll drop my email as well.
Eliana,
Thank you. Yes, I think Josephine shared it in the chat, but just to, say it again, repetition is key. The in partnership with San Joaquin Health Centers, the MCPs and a few other local community-based organizations are also hosting the 25th annual Binational Health Month. It's also a celebration of health, and there's actually 3 events coming up in October. October 4th, it's going to be in Stockton, October 19th in Galt, and October 25th in French Camp. And I can share the flyer after the call. We're going to have an array of different services, including flu shots, BMI screenings, dental screenings. HealthNet will be bringing our dental van in partnership with Smile California to also provide services for the event on the 25th. There's also going to be mammograms, and so an array of different services. And I know that a few of our ECM providers actually attended the event last year and also tabled. So if there's an opportunity for providers who are interested in tabling and engaging members to either enroll in services or just to find out more, I can definitely share that information with this team.
Thank you, Eliana. That's great. And I think Health Begins is also supporting the binational event. So that's great to see. And so I know last year it was a pretty big event. There was lots of giveaways too at the very end. So definitely get out there, inform people, inform the masses, lots of free services and that are going to be beneficial for the community. So thank you again. Anybody else?
Hey, John, Casey with Turning Point.
Hey, Casey.
Kind of just a sad update news. Don't know if anyone else on the call has heard, but Downtown Streets team unfortunately is officially closing their doors. So we will have a lot of members between all the counties that they do serve. And if I remember correctly, it's approximately 16 different counties where individuals that were connected to them will now need to get support. In addition to that, with sadly closing the doors, those will be individuals that will now need to see if they can get connected to another employer. So if you have openings, please feel free to send me any information. I'm more than happy to forward it over to their senior program director as well. And I'll put my email in the chat for anyone.
All right, thanks, Casey, for that information. That's really thoughtful. I appreciate that. Anybody else have any information that would benefit us? All right, see, Casey already uploaded his email address. I think that's it for regional spotlights. If you guys ever want to share something in the future or talk about your organization and present it, please reach out to Navneet or Melissa, and they'll be able to walk you through the process.
Thanks, John, and thank you everyone who shared. At this point, I'm going to pass it over to Rebecca to do our PAVE overview.
Thanks, Navneet. I appreciate the opportunity to be here today to talk about PAVE. You guys are going to learn what that is and when you're going to use it today. But before I dive in, I just wanted to say a thank you for being able to join you all in person in Modesto. It was so wonderful to see everyone in 3 dimensions and also to just experience the level of engagement and enthusiasm among this group, which is, I mean, we've had a little bit of a quiet call today, but seeing you all in person is just very rejuvenating. So thank you all so much. Let's go to the next slide, and I'll just mention if you have questions, please put them in the chat. And there'll be an opportunity at the end. We'll go through those, and then you can unmute as well. All right, so before I get into what is PAVE exactly, I want to remind you guys that if you are an ECM provider that is serving justice-involved individuals, or also known as individuals transitioning from incarceration, then you're going to need to be operating in 2 reimbursement model worlds. You're very familiar with the post-release. Folks are back in the community from incarceration. They are getting ECM services, and this service is covered under Medi-Cal managed care. So you guys have contracts with managed care plans. You are billing the managed care plans for those services, and so you're all very familiar with that. If you are serving this population of focus, you are also going to need to operate in what's called the Medi-Cal fee-for-service model, and that's because in order to get reimbursed for services that you provide to individuals while they are incarcerated, so that would include the warm handoff and any other services that you're providing pre-release, so before an individual is back in the community, then you need to be in a position to enroll as a Medi-Cal fee-for-service provider and get reimbursed directly from the state for those services. Unfortunately, these are 2 different models that you're going to have to navigate. You're going to have to exist in both of these worlds. We talked about this quite a bit in the in-person meeting, but I want to remind you all of this because it is an added and unique requirement of serving this population in focus that you all need to be aware of if you're thinking about it, or if you're already signed up with the MCPs to serve this population in focus. So today, I'm going to focus on that big teal arrow pointing at the requirement to enroll as a Medi-Cal fee-for-service provider. So let's go to the next slide. All right, so what is PAVE? PAVE stands for Provider Application and Validation for Enrollment. It is an online portal that is going to be used by ECM providers and many other providers to enroll as a fee-for-service Medi-Cal provider. As I mentioned, this is required in order to serve individuals transitioning from incarceration, population of focus under ECM. What it is not is a Medi-Cal billing portal. Okay, there is a whole separate way to do that. PAVE is simply the portal you will use to enroll as a Medi-Cal fee-for-service provider. That is all that it is. And it is critical for those of you who are serving this population of focus. So if you have not started to do that, and you're either already signed up to serve justice-involved individuals as an ECM provider, or you are planning to, then this is something you're going to want to get started on right away. Next slide. Okay. There are many different types of providers that can enroll as a JI provider. So you'd enroll, providing ECM services for individuals transitioning from incarceration. You're going to have managed care plan contracts. And then, as I mentioned, you're going to need to also enroll as a Medi-Cal fee-for-service provider. So this is the list of who can enroll as a JI services provider under PAVE, fee-for-service Medi-Cal. Today, I have highlighted I bolded the CBO line here for 2 reasons. One is this is actually a new provider type that the state has had to add, and it's taken them a little bit while to do it. but it is in PAVE now. And two, this is going to be the focus of the rest of my presentation today. I'm specifically going to be speaking to CBOs who are serving as justice-involved ECM providers and what you guys need to do with regard to PAVE. If you are in that category, you are a CBO and you already are or you are planning to serve justice-involved individuals or individuals transitioning from incarceration, please drop in the chat your organization name because we'd love to know who is out there doing this. Next slide, please. Okay, so there are several requirements that CBOs need to meet in order to submit an application in PAVE, and they're listed here. The number one that you should be aware of is that CBOs must be nonprofit organizations. That if you are not, if you do not have that designation by the IRS, then you will be denied through PAVE. Okay, so there does not exist a for-profit CBO pathway in PAVE for approval. Right now, it is only nonprofit organizations under the category as a CBO. Now, you could maybe enroll as another type of provider, and I gave you that whole list. But if we're talking about CBOs, you have to be nonprofit, okay? There's other things that you'll see listed here, like you need to have an administrative service address, you need to have a federal EIN, and you need to also designate on your application that you are going to be providing justice-involved services. I also have listed here CHW and asthma prevention because those are also some unique pathways of services that you can provide as a CBO. So you need to designate on your application which of these things are, single one of these things or multiple that your organization is enrolling as. And you'll have to submit some disclosure requirements as well. The other notes that I have at the bottom of the screen are that for your nonprofit orgs, you have to obtain what's called a Type 2 National Provider Identifier, NPI number. It's an organizational NPI. And this is something you get at the federal level. So if you have not gotten an NPI for your organization yet, you're going to need to do that. It's actually very easy to do. I do provide a link to that later in the slides. So just be aware that is a prerequisite. You need to get that first before you apply. And then an interesting note here, CBOs do not need to have a licensed medical provider on staff in order to enroll through PAVE. So be aware of that. This may be a requirement for other application types, but not for CBOs. Next slide. Okay, as you can imagine, there's a bunch of documents that you guys would need to submit to justify your 501c3 nonprofit status, for example, and your business licensing, etc., which are all listed here. And I provide a reference at the bottom to what's called this checklist, which I think you guys will find very helpful for those CBOs that are looking to enroll through PAVE. I'm going to drop it in the chat along with another resource I'm going to mention shortly. We can go to the next slide. Okay, high level, what does the enrollment process look like in PAVE? There will be first you guys need to go in, get an account in PAVE, fill out your application, and then submit it, okay? Then the state Department of Healthcare Services, which is the state agency that oversees Medi-Cal, does have 180 days to review it. I know we have heard anecdotally that folks are waiting months and months and months to get a response to their PAVE applications. And that is because of this timeline that the state has to work under. So again, you're going to want to start this ASAP if you haven't done so already. If you get a response, you may get a response back that says your application is incomplete and the state will ask you for corrections. You'll have the opportunity to go into PAVE, make those corrections, and 60 days to respond with those corrections. There may be several back and forth within this category of correcting deficiencies, which could lengthen the time period even more. And then eventually you'll either get your application approved or denied, and you'll get an email indicating that, and then you can log into the portal, the PAVE portal, and get your letter. If you are denied, you'll have information on how to appeal as well. Next slide. Okay, this is the other, this image on the screen with the arrow is the other resource that I put in the chat. And it does provide, it's developed by the state, and it does provide a very handy step-by-step instructional guide with screenshots on how to get started in PAVE. So if you haven't done so already, this may be a handy resource. We can go to the next slide. And then wrapping up here, there are several common denial reasons that the state has published to for folks to be aware of. So I'll go through these. Firstly, and I mentioned this earlier, you do have to indicate when you submit your application what services you're going to provide. So if you're a CBO, you can provide one of these following services: the CHW, asthma prevention, or justice involved services. So you need to select at least one of these. Otherwise, it's gonna get kicked back. You also need to report all of your board members and all of your managing employees. So just, know that you got to put a lot of this information in the system. It may take a little time. So just make sure you're thorough in that. And then the last thing is one that I've touched on at the beginning, which is as a CBO, you do need to be enrolled as a nonprofit organization. You do need to have that designation and be able to prove that with your documentation. So please make sure you take care of that before you do begin your PAVE application. Next slide. Melissa shared the link to the slides. It has all of this information in there. I've provided you guys with a link to the PAVE portal itself. There is a PAVE help desk that you can access or call for technical assistance needs. If you have questions about Medi-Cal enrollment, more specifically, you'll want to talk to the provider enrollment division within Department of Healthcare Services. Here's some resources for that there. A few online resources to share with you guys there. And then at the bottom is the where you go to get an NPI number. Next slide. And we'll wrap up with any questions that you guys have. You can unmute and ask them now, put them in the chat. I'm gonna look in the chat as well. And then if there's anything else resource-wise that would be helpful, we'd love to hear that, how we could support you guys further. Carrie, I see your hand up, go ahead.
So I just went through this and did all this. I just wanted to share another caveat just to be aware of. They not only ask for all board members, but they ask for a driver's license, a social, and an address for all of your board members. So just be aware. It was a big ask. A lot of my board members weren't super excited about it. Just heads up.
Yeah. You may come across that scenario with the NPI numbers as well, needing to provide socials. So just bear that in mind. I know that's been concern for some folks as well. But Carrie, appreciate you sharing. In fact, I was going to ask you guys if we were able to bring on, and maybe Carrie, you're someone who could do this, if we were able to bring on somebody who has gone through the PAVE process and could share their experience. If that would be helpful to you guys, we'd love to arrange for that at a future meeting. So Carrie, is that something you'd be willing to do?
Sure.
Sure. Not so enthusiastic probably about the PAVE piece, but that's great that you're willing.
You know what? It wasn't that bad. Okay. I mean, it was time consuming and my board members weren't thrilled. I got kicked back for one correction. I did it. It got approved, I'd say within 6 weeks. I didn't have a bad experience.
Wow. So your whole experience was 6 weeks?
Yeah.
Wow. Okay. That is probably a record. I don't know that I've heard it that quick. So
yeah, it was not bad. Not bad.
Did you do it recently, Carrie?
Mm-hmm. Yeah.
Okay.
I think I got my approval maybe a month ago or something.
Okay. All right. Well, that's wonderful. Congratulations. It's possible that there's a level of urgency the state is placing on this just because this is a requirement for serving this population of focus, and correctional facilities have started to launch pre-release services. So they need the ECM providers to be ready to go in PAVE so they can, if the ECM providers are doing any pre-release work, you guys have a way to get paid for that. So you really do need to get this piece sorted in order to have that pathway. So I'm glad to hear that, Carrie. That's wonderful. Eliana, go ahead. Maybe some managed care insight you want to share.
I hope so. Thank you so much, Rebecca. This was extremely helpful. We know that this is a pain point for our providers. I do want to just kind of call out that at least for San Joaquin and Stanislaus, and I'm not going to speak for our plant partners, but in some ways I am, just because we're working so closely on the JI front, is that we have a selected number of providers who have been selected to serve as a JI, ECM post-release kind of team. And so if anyone else is interested, and before you start digging into this PAVE application, and it sounds like reaching out to your board members and kind of gathering some of that personal information, go ahead and reach out to your MCP partners, like myself, Nayeli, I think Kat, the team that was presenting an update earlier, just to make sure that one, we are accepting new providers. We're continuing to learn month by month on what is the capacity that we need to serve the population. So right now, again, for both counties, we have a selected network. Doesn't mean that we're not going to add in the future, but before you start, kind of gathering this information, let's go ahead and have a conversation because it is a little bit anxiety provoking to start requesting some of this personal information from your stakeholders and from some of your partners. So let's have a conversation and then let's see where we can go from here. I think all the plans also have some additional resources around PAVE. There's phone numbers and there's resources that we can also provide. But so just wanted to kind of put that out there. Let's have a conversation first and let's just kind of see where we are with the network.
Absolutely. Yeah. Thank you so much, Eliana. The PAVE enrollment really needs to be complementary to the managed care plan contracts. So it is really important that you reach out to the MCP contacts that were listed today to have that conversation. If you have not started that, if you want to serve this population of focus, because there is a tight network around this because of the unique requirements that do need to be met, including this pre-release PAVE fee-for-service Medi-Cal. All right. Any other questions?
Not necessarily a question, but well, I guess it is a question / comment about the whole social security number, driver license. I'm assuming that there is not a way around that. Like if you have 11 board members, you have to provide all 11 board members social security number, driver license, addresses, all of the above.
Yeah, I believe you do.
Okay. All right. Thank you.
I have a question.
Yeah, please.
So we are transitional homes, so we actually get the guys when they come from prison, but through a paid program. Would we be able to be providers through PAVE to get something started, or we have to fall under one of those categories and names of everything you had listed, correct? Because I got an MPI number. I do have an MPI number, and I have a nonprofit. But
Great. So the sort of housing service that you're talking about specifically would be probably most closely aligned to community support services.
Okay.
There are various housing related ones there. So the same managed care plan contract or contacts that were on the call and provided their information earlier would be the best place to start for that. If you're now looking to, let's say, expand your service offerings to include enhanced care management, which is ECM, which is more of a care management function and sort of a navigator role, then you would start to explore serving this population of focus. But I think the starting point for you guys is probably community supports, given the services that you already provide today. And the managed care plans are the ones that are responsible for essentially at the end of the day, providing those services. They go through the managed care plan contracts versus direct from the state provided services. So those folks will be the best ones to start the conversation with on that piece.
How will we get in contact with the community care?
Yeah, so you're going to want to talk to, if you're serving Stanislaus or San Joaquin County, then you're going to want to talk to any of the folks that presented earlier from HealthNet. Eliana was on the call, from Kaiser, and from San Joaquin Health Plan of San Joaquin. And maybe we can have someone make sure that from the team, make sure that you have access to the slides for today with the contact information.
Okay.
Yeah, I can make sure to email those out to you all.
Okay, thank you so much.
Yeah, you're welcome. All right, Navneet, I think I will turn it back to you unless there are other questions that pop up.
Awesome, thank you. Appreciate everyone's questions and the active discussion. So now we're going to move on to the last section of today's meeting where we'll just share some resources and announcements and then kind of wrap up with next steps. So the first kind of announcement we wanted to make was just around some webinars that are happening. There are the CPI best practices webinars that happen twice a year, and there is one coming up in October on the 24th at 10 a.m. where DHCS will host a webinar on strengthening connections with children and youth providers. So during the webinar, they'll talk about how First 5 programs across California are working with ECM and community support services and providers, as well as explain how schools and school districts can help connect children and families to local organizations, youth programs, and health plans. So encourage you all to check that out if that's of interest, or if you serve the children and youth population of focus, this might also be helpful to join. The second webinar is around braiding funding. And sorry, I don't have the date here, but we do have the link for the webinar. And this is going to be hosted by the Center for Healthcare Strategies, where they'll be featuring 3 organizations that are currently braiding funding. One of the organizations serves older adults and people with disabilities. The other is a housing related service provider and a specialty behavioral health provider. So this webinar will be really helpful for folks. I know braiding funding comes up a lot, and folks are constantly curious about how other organizations are approaching different funding streams to support sustainability. So encourage folks to check that out. And I think we'll either drop the webinar link or it will be available in the slides, and I'll make sure to share that out via email. And then kind of just building off of some additional resources. I know in the last meeting, we shared the ICE cards that Health Begins created. This is another resource from one of the other facilitators from Intrepid Ascent. They've created a few booklets as well as a migrant family safety plan toolkit. So wanted to share this as a resource, as it may be helpful to share with the members that you all are working with. And we do have these resources linked, as well as another slide with just additional resources that folks can check out if they want to get more information, as well as some agencies that you can kind of look into that are doing more of this work. And if there are local agencies that you would like to spotlight or uplift, feel free to share those with me, and we can make sure we update this slide as well. And then the next 2 slides are a few question and answers of just questions that have come up to DHCS that they have provided some guidance on. So we just wanted to share this with you all as well, so you're aware. There were questions to DHCS around housing deposits, and essentially if there are any changes to update the guidelines. So MCPs would be responsible for covering the money up front rather than CBOs. DHCS has responded that they don't have any plans at this point in time to change the housing deposit guidelines that were outlined in the Community Supports Policy Guide, that allows, and then that the current policy allows managed care plans flexibility in how they operationalize housing deposits, including reimbursement arrangements, but it doesn't require MCPs to pay the full amount upfront. And the other thing that DHCS just wanted to comment on is that they do recognize that there are challenges, especially from the CBO side, to provide money up front, and just encourages providers to work with their MCPs to make sure that they're able to address any issues, so we can continue to support members. And then the last one, I know there's been questions around closed loop referrals and whether MCPs have been given an extension. I know we previously, early in the year, were talking about how closed loop referrals were going live in July, and I know there are some health plans that are going live a little bit later. So DHCS just wanted to share that there is no formal extension timeline, but they are working collaboratively with MCPs, just knowing that they're at various stages of implementing closed loop referrals. And then there's just additional guidance here and clarification. And then I know we already kind of shared about the Binational Health Month, so just wanted to spotlight this again. That it will be happening. There are 3 different events. Last year, we partnered with San Joaquin Health Centers on their Celebration of Wellness Health Fair. So just wanted to share that again. I know we had a decent amount of organizations participate as vendors. So we were able to connect with Charles at San Joaquin Health Centers, and he did share out the registration packet, which we can drop in the chat for folks that are interested in participating. Also have included the event flyer, and if you have any questions, you can email those to Charles. But I know last year was a really great event. I'm sure it's going to be really great this year as well, and it's just a great opportunity to share about your services and connect with community members. So encourage you all to check that out if it's of interest. And then lastly, just wanted to close out with another announcement. I know previously we were planning to host a in-person session in November. We've decided to just do the rest of our sessions virtual for the rest of the year. Just acknowledging that there's a lot of stuff happening in November with holidays and it might be difficult for folks to come out. So just wanted to ask in terms of for our own planning purposes, and being responsive to be what would be most helpful if it would be if the preference would be to host office hours either directly after the session on the day of the session on Monday, November 17th, or if we should do it how we typically do it, which is usually on a different day, which would be on the Thursday of that same week. So just wanted to get your feedback on what would be easier, whether the same after the session or on a separate day. And I see folks are answering that poll, so really appreciate that. I will give folks maybe 30 more seconds to fill that out. I see it's getting pretty close, so if you have a preference, might be the best to put that in. And then with that, just wanted to close this out with some additional just next steps. The first is around office hours, so continuing to kind of build on some of our sustainability work and sharing resources. I know in the in-person, we did have folks share that they wanted to learn more about the Camden Budget Estimator tool, so we'll be taking some more time to kind of talk through that. And those office hours will be held with our Northeast Collaborative as well on Monday, September 29th. And then, as always, we hold space for folks that may need additional support or want to request a one-on-one. And you can email me for those requests. And I think with that, that's all that we have for today. Really appreciate everyone being on today, asking your questions. Really appreciate your feedback on that. And with that, I think we can close out for the day, and I hope you all have a great week. Thank you so much.